NCSB question types explained with practice questions. Question 1. The nurse in the pediatric clinic is caring for an acutely ill, 10-year-old child. Which assessment finding would require immediate intervention by the nurse? Option A, slow, irregular respirations. Option B, temperature of 101. Option C, degree F, 38.5 degrees Celsius, 3 rapid, bounding pulse. Option D, profuse diaphoresis. The correct answer is option A, slow, irregular respirations. 1. Question 2. The nurse is preparing a client for a pulmonary CT angiogram with contrast to rule out a pulmonary embolism. For which laboratory result should the nurse notify the healthcare provider immediately? 1D, dimer level of. Option B, mg/ml, 2 serum creatinine level of 2.8 mg/dl. Option C, arterial blood gas POW2 level of 80 mm Hg. Option D, serum troponin level of 0.1 mg/ml. The correct answer is option B, mg/ml, 2 serum creatinine level of 2.8 mg/dl. 2. The client's creatinine level is significantly elevated. Normal creatinine level is 0.8 to 1.2 mg/dl, placing the client at risk for dye-induced renal failure, and the nurse should notify the healthcare provider of this lab result immediately. Question 3. The home health nurse is reviewing the medical record of a client with closed-angle glaucoma in both eyes. Which statement by the client would support this diagnosis? Option A, I have specks floating in my eyes. Option B, I have to turn my head to see around the room. Option C, I can't see out of my left eye. Option D, I have constant blurred vision. The correct answer is option B, I have to turn my head to see around the room. 2. Question 4. Which action should the nurse take before communicating with a client diagnosed with presbycusis? Option A, check the client for cerumen impaction. Option B, ask for permission to turn off the television. Option C, request a medical translator. Option D, wait until family members have left. The correct answer is option B, ask for permission to turn off the television. 2. Question 5. The nurse is planning care for a client diagnosed with Guillain-Barré syndrome. Which problem should the nurse identify as a priority? Option A, difficulty breathing. Option B, altered bowel elimination. Option C, partial or total immobility. Option D, nutritional deficits. The correct answer is option A, difficulty breathing. 1. Question 6. The nurse is providing care to an 80-year-old client with the diagnosis of advanced Parkinson's disease. The nurse should know that the greatest risk to the client is related to which finding? Option A, difficulties with reading and seeing at night. Option B, extreme weakness in the lower extremities. Option C, drooling and coughing when eating. Option D, dizziness and syncopal episodes. The correct answer is option C, drooling and coughing when eating. 3. Question 7. The home health nurse is reviewing the plan of care for a client experiencing acute attacks of Meniere's disease. What is the priority intervention for this client? Option A, instruct the client not to drive a motor vehicle. Option B, provide assistance with bathing and dressing. Option C, communicate clearly and use visual aids. Option D, encourage bland foods and non-carbonated fluids. The correct answer is option A, instruct the client not to drive a motor vehicle. 1. Question 8. The nurse on the inpatient unit is expecting the admission of a client with a new onset of seizures and instructs the unlicensed assistive person, UAP, to prepare the client's room. Which piece of equipment should the UAP make sure to place in the room? Option A, soft wrist restraints. Option B, an oral airway. Option C, a bedside commode. Option D, pads to be placed over the bedside rails. The correct answer is option D, pads to be placed over the bedside rails. 4. Question 9. The nurse is providing care for a 40-year-old client suspected of having Guillain-Barré syndrome. Which intervention should the nurse plan for? Option A, genetic testing of the client's children. Option B, a bone marrow biopsy. Option C, administration of immunoglobulins. Option D, implementation of airborne precautions. The correct answer is option C, administration of immunoglobulins. 3 intravenous immunoglobulins, 4Ig, are used to treat Guillain-Barré in the early phase. They are believed to interfere with antigen presentation and help to modulate the body's immune response. Question 10. The nurse in the neurology office is reviewing information about levetiracetam with a 30-year-old female client with a history of seizures. Which instruction about the medication should the nurse make sure to include? Option A. You might experience irregular menses and intermittent bleeding. Option B. Call the office immediately if you feel like hurting or killing yourself. Option C. You should stay away from large crowds and sick children. Option D. You should avoid becoming pregnant while taking this medication. The correct answer is option B. Call the office immediately if you feel like hurting or killing yourself. 2. Levetiracetam is an anticonvulsant medication used to prevent seizures. One of the significant side effects is behavioral changes and suicidal ideations. Question 11. The nurse is performing a home visit for an older adult client with Alzheimer's disease. Which of the following observations should be a priority for the nurse to address? Option A. Good lighting in the stairwell. Option B. Throw rugs on the kitchen floor. Option C. Lamps plugged directly into wall outlets. Option D. Handrails in the bathtub. The correct answer is option B. Throw rugs on the kitchen floor. 2. Question 12. The nurse is collecting data from a college student who comes to the health clinic with symptoms of meningitis. The student resides in the school dormitory. What is the priority action the nurse should take? Option A. Perform a focused neurological assessment. Option B. Administer acetaminophen for the headache. Option C. Alert the college's administration and dormitory staff. Option D. Obtain the client's immunization history. The correct answer is option C. Alert the college's administration and dormitory staff. 3. Question 13. The clinic nurse is following up with a client who was seen a few days ago for trigeminal neuralgia. Which action by the client indicates an understanding of how to manage the condition? Option A. Takes an analgesic after performing household chores. Option B. Keeps the environment at a moderate temperature and free from drafts. Option C. Eats a bowl of hot, steaming soup every day for lunch. Option D. Performs vigorous brushing of teeth twice per day. The correct answer is option B. Keeps the environment at a moderate temperature and free from drafts. 2. Trigeminal neuralgia is a disruption in the cranial nerve and causes sudden, severe, brief stabbing pain. Keeping the environment at a moderate temperature and free from drafts can reduce the risk of triggering an acute attack. Question 14. The nurse is caring for a client who has a history of peptic ulcer disease. The nurse notes the abdomen is rigid and the client complains of severe pain with palpation. What is the priority action by the nurse? Option A. Record the findings in the client's record. Option B. Ask the client about dietary habits. Option C. Notify the healthcare provider of the findings. Option D. Review the client's record for NSAID use. The correct answer is option C. Notify the healthcare provider of the findings. 3. Question 15. The nurse in the primary care office is reviewing after-visit instructions with a client who was recently diagnosed with gastroesophageal reflux disease, GERD. Which action should the client implement to decrease the symptoms associated with GERD? Option A. Increase oral fluid intake to 4 liters a day. Option B. Avoid caffeinated and carbonated beverages. Option C. Eliminate dairy products from the diet. Option D. Limit foods high in fiber. The correct answer is option B. Avoid caffeinated and carbonated beverages. 2. Question 16. The nurse is educating a group of individuals about how to prevent hepatitis B and C. Which statement by the nurse would best describe prevention of these two diseases? Option A. You can eat fresh fruit picked from the tree without the need to wash. Option B. You should use protection when engaging in sexual intercourse. Option C. You should talk to your healthcare provider when traveling internationally. Option D. You can receive a yearly vaccination to prevent the diseases. The correct answer is option B. You should use protection when engaging in sexual intercourse. 2. Question 17. The nurse is reinforcing teaching with a client regarding their diagnosis of hepatic encephalopathy. Which statement by the client indicates that additional teaching is needed? Option A. I will brush my teeth with a soft toothbrush to avoid bleeding gums. Option B. I will eat enough protein and calories to stay healthy. Option C. I will stop taking ibuprofen for my knee and back pain. Option D. I will stop taking my lactulose when I have more than one loose stool. The correct answer is option D. I will stop taking my lactulose when I have more than one loose stool. 4.